Good morning. Happy Friday to each of you. This is the end of the week. I'm Tennie McCarty, and I have a small treatment center in Buffalo Gap, Texas, called Shades of Hope Treatment Center, and Buffalo Gap is in the center of Texas. We're an all-addiction treatment center with a primary focus on eating disorders and codependency. And this week, we've been talking all week before last, it was National Eating Disorder Awareness Week, and we had intended all year to do some publicity and some public service announcements and things like this is one of them. But we had a blizzard that week, in West Texas. We had 14.8 inches of snow, so it's obvious we couldn't do what we're doing this week by doing these videos. And then last week we did an intensive. So this week we have been celebrating Eating Disorder Awareness Week. And the theme of it has been everybody is welcome at the table. Everybody is welcome at the table. And come as you are. So what that means is regardless of the eating disorder, regardless of the age, whatever, it doesn't matter. If you have a problem with food of any sort in the beginning, middle, or last stages, this week has been for you. So today, we've talked about the different types of eating disorders. We've talked about eating disorders in men. We've talked about eating disorders in children and teens, and what parents can do to intervene and to help. And so we're ending this week with talking about, what does recovery look like? What are we going toward? It's like any goal. If you don't know what you're going toward, you never know when you get there. So with eating disorders, though, after saying that, it is not black and white. It's not just, okay, we do this and then we're done. No, it's an ongoing process. Eating disorders are diseases. They go through the same addiction cycle as drugs and alcohol do. I think we're probably one of the few eating disorder units that actually treats it as an addiction. We treat it as an addiction, we treat it as a disease, we treat it as a behavioral problem, we treat it as all of that because it is. And what eating disorders do is they respond very well to addiction treatment. So I want to talk today about what recovery looks like, and recovery will look different from one person to another. And in recovery, that's why we have to kind of be careful. In the disease, I've never known an eating disorder yet, a person yet that, whether it's a man or woman, that didn't consciously or subconsciously compare their bodies to someone else's. They'll either do it silently or out loud, and then they'll engage family members in helping them do that, by saying, honey, am I as big as that woman there? I know my top weight was 287 pounds, and back in those days in the late 60s, early 70s, my husband and children and I had gone to the fair. Every September we have a big West Texas fair here, and I knew I was large. I wore like a 28.5 dress, could hardly find anything to fit me. And we were walking down the freeway, and I just bought this black and white striped seersucker dress. I had ordered it from Sears Roebuck, and it actually fit, and I thought I was looking pretty cute. And then there's this woman, very large, obese woman, coming toward us. And guess what? She had on the same identical dress that I had, that I thought I was looking cute in. And so I asked my husband, I said, honey, am I as big as that woman coming toward me? Right there. Am I as big as she is? Whispering to him, am I as big as she is? And what he said was, honey, no, you're not. And he looked off. And, in reality, I knew I was larger than that woman, but I wanted my husband to tell me different. So that's what we do. And in recovery, how you can tell that you're in recovery is we stop noticing, paying such close attention to other people's bodies and comparing ours to them, because we feel like we never ever measure up. But in recovery, we do measure up. We do. And in recovery, there becomes a real self-acceptance that we have of ourselves and our bodies. But until we reach recovery, one of the things that we say, every excess pound that a person weighs or underweighs, whether you're anorexic, every excess pound that you're carrying or not carrying represents unresolved pain and anger. And so, the physical aspect of an eating disorder must be addressed, whether it's overeating, morbid obesity or binge eating, anorexia or bulimia, binge and purging, bulimia. All of those carry physical symptoms that have to be addressed. And how you know that you're recovering in the physical side of it, as the symptoms, you don't act on the symptoms anymore, or maybe you're acting less. When people come to treatment, such as Shades or other treatment centers, they detox from the behavior of the eating disorder. They stop acting out of the eating disorder. It always amazes me here in Shades, the food, regardless of which direction the client is in, anorexic, bulimic, it takes about 10 days sometimes for the food to get in order. Once the food gets in order, they look and sound well. They don't maybe necessarily look well, but if that's all there was to it, is getting the disordered eating in order, they'd be in recovery. But that just gets us to the starting gate. The main problem lies in the mind. It's in the thinking. It's on that mental and emotional side. So that's when you know that you're in recovery. Another reason is when those issues of the past, what we believe in, that we must work on the core symptoms of what's driving the eating disorder. And usually that core symptoms is pain, anger, fear, shame, guilt that's held over from usually the childhood. And so here at Shades, we do a lot of work around that pain that people are carrying around. And so that's on the mental and emotional side, but you can't work on that, I don't believe. You can work on the mental and emotional side until the acting out of the eating disorder has stopped. And so one is the physical symptoms have either slowed down or they have stopped on an outpatient basis. I used to run, I still do, have a small private practice. And about all you can hope for on an outpatient basis is to encourage your patients or your clients for the symptoms to slow down. If a bulimic is purging 10 times a day, recovery might look like for them to cut it down to twice a day. And you keep cutting it down to one day you're not binging and purging at all. And for the anorexic, they're very hard to treat, and especially it's almost impossible to treat an anorexic or a bulimic on an outpatient basis. And if you were, if you can get an anorexic to just start eating, just up the calories, even 200 calories a day. It's slow. It's a much slower procedure. So recovery looks like getting the physical symptoms in order, and then working on the emotional and mental side. Now that emotional side that's going to be ongoing. Recovery from an eating disorder is really ongoing. There's no we're going to do all of this and then we are cured, I have really been addressing the eating disorder that I have had since 1972. And I'm not really an exception to this. I mean, I was really chronic in the disease, in as far as severe bulimic, and farmer, obese, up to 287 pounds. And so that's not unusual. I mean, I'm not the worst of the worst. We treat people like me all the time. And so you're not going to get a quick fix there. Or for an anorexic weighing 70 pounds, there's not going to be a quick fix. Just losing the weight or gaining the weight is, although that is addressing the physical, that just gets you ready to treat the mental and emotional side. And the thing about that is, like I was going to say, it can take decades. Now, it doesn't mean that you're not going to be healthy along the way, but you keep doing the work, and it's like peeling off layers. You get healthier and healthier and healthier. And I've never really thought I knew what a normal weight range for me would be, because it was really not. I mean, it's about the weight until it's not. Let's face it. When you're morbidly obese, you want to lose weight. And for me, at my height, I was just thought it would be heaven to weigh 175 pounds. Then I kind of moved that up to about 150. And I was just talking to my friend here, and that has known me several years. And really, it started about, really when I went to treatment 36 years ago. The weight started coming off 10, 15 pounds a decade. And today I'm within a normal weight range, having surrendered 160 pounds. But I didn't count the calories. I didn't stay on the scale. I didn't do all that eating disorder stuff. I just stayed on a food plan. I did my prayer and meditation. I went to Overeaters Anonymous on a regular basis. I had a sponsor, which I still do, and called on a regular basis. I waited and measured my food until I learned what a serving size was. I did all those things that we're taught to do in recovery. And, today, it's been from 1972 to now, I consider myself in recovery. I'm a recovered. But I didn't say that for many, many years. What I would say is I am a recovery. I was in the process. Now, I'm not so arrogant to say that I can't relapse. Any of us can. Any of us with the disease of eating disorders or addictions. But today, I am the best self that I have ever been. And that's been a lot of hard work on my part, and a lot of work and help from others, and from the God of my understanding. I believe this is a spiritual problem. So the spiritual comes in. So we have a physical and a mental and emotional and a spiritual problem. So like I said, another thing is recovery is ongoing, and it may take longer than what you think. So don't give up. And another thing is, the reason that you'll know when you're in recovery is you'll stop using excuses. Like if there's a big party maybe or something at your husband's work or your work, and you wake up that morning and you feel fat and you can't find anything to wear, or you're afraid of the food that's going to be served if you're recovering anorexic, if you have a fear of the food, or you're afraid, if you're bulimic, that you're afraid that you will eat all too much food and then have to go to the bathroom and purge. When you know that you're in recovery, you can suit up and show up and go anywhere. The food will take its proper place. You will have no fear about the food, but it may take years to get there. And in the meantime, you don't live out your life head out at home. You get out and you do things, and you have support. And but when you know that you're in good recovery, is that you can go anywhere. And you may not like the food that's served. It may not be the best thing for you. And if you're in good recovery, the guideline for recovery from an eating disorder for the food particularly is if you can take it or leave it for a compulsive overeater. But if you have to have that certain thing, you're probably not in real good recovery. Or if you're on the other side, the anorexic side, and you cannot eat certain foods, that's a red flag about you might have some more recovery trails to take. So food takes its proper place. And then you begin in recovery, you begin to understand the patterns and the truth about yourself. And that's what good recovery and work with a therapist and eating disorder treatment, whether it's at a treatment center or outpatient, or it's you begin to see the truth about who you are. And when you start seeing the truth about yourself, the truth's going to set you free. You're going to realize that you're not bad, awful, and wrong, that you're not, you wasn't born guilty. You don't, you don't have to carry around shame of having an eating disorder. And so, and when you can start accepting yourself as the perfectly imperfect child of God that you are, you're going to know, I'm in pretty good recovery. I love myself today. I like myself. And how you know that if you like yourself, I worked with a group of Russians one time that they brought over they were here for training in the States for addiction training. And one of the women was a bulimic, and they had been in lots of training across the United States, and not one person had picked up that she was a bulimic. And I asked her if she was a bulimic, and there was a doctor. Anyway, it came down that she was a bulimic, and she stayed and came back to Shades of Hope with me and went through treatment. And what she said at the end of her treatment, she said, I have taken a liking to myself. That's when you know that you're in recovery, when you have taken a liking to yourself. When we're in the throes of an eating disorder, we hate our own guts. We hate ourselves. And so we can even be diagnosed by a professional. And if we don't feel good about ourselves, we don't feel worthy of treatment. And we won't take their word, but we won't think that we're that bad enough to get treatment. But when you are in good recovery, you will listen to professionals and know that when you are stabilized and when you are in recovery. And so we have to have other people sometimes to validate our own reality. And so when you'll know that you're in good recovery when you can see those ads pop up on TV about the newest fad diet, and boy, they make them look good. And on Facebook and all those on Instagram, when all those diets and things from that have been on TV, and one tablet and you're going to lose all the fat, it'll just melt away. When you see all of that and it doesn't intrigue you or doesn't make you want to call and order that particular thing, you know that you're in recovery. Now, for a while, it might tickle your brain. It might, but if you don't act on it, and if you talk about it, and you don't get back into that spiral of dieting, you'll know that you're in good recovery. And then another way that you'll know that you're in good recovery is, if you're looking at magazines, women's magazines or any magazine where they are any on TV, and I'm going to contradict myself. I've started noticing on TV commercials, they're starting to use more normal weight people, or even people that are somewhat overweight. They're not doing just the perfection, and I'll tell you the reason for that. Those of us in the eating disorder field have fought for that for years, not to put just models, thin, tiny models on there, because when people see that, a lot of times they'll compare their bodies to the people in the magazines and the ads on TV, and we don't measure up. So you'll know that you're in good recovery when you don't do that, when you don't compare your body to someone in the modeling profession or advertising. And then you'll know you're in good recovery when you learn to manage your eating disorder one meal at a time, one day at a time. It gets to where it's not one meal. It gets to where we get a daily reprieve. We get a daily reprieve contingent on being in fit spiritual condition. And so you can treat the physical and, gain the weight that you need to gain if you're anorexic. And that's easy for me to say, and it's one of the hardest things in the world for an anorexic to do, and to sit with that small weight gain a little bit at a time. And then it's hard for an eating disorder client to be willing to just settle for 2-3 pounds a week of weight loss instead of, wanting the enormous amounts of weight loss. But when you begin to see the change in your body, and you've got, and the physical part has pretty much taken its proper place, where you're working on it one day at a time, then that's where the ongoing process is the mental and emotional part, and the spiritual is the solution. So if you're in good recovery, it doesn't mean that you're not going to have problems, folks. It's not that. But what it means is when you have a problem, like your kid gets in trouble in school, instead of you going to the refrigerator trying to find something to take in to ease that pain, or if one of them gets sick, or you lose your job, or this happens or that happens. The pandemic has brought on eating disorders and lots of relapse around eating disorders because people are dealing with, situations we've never had to deal with before. And when you notice that you are dealing with live situations with your eating disorder, you know that you're not in recovery. But if you can have, what we say, recovery is about not what happens to us. It's not has anything to do with what happens to us. It's how we go through it. When we have a problem, if we can go through it without going back into eating disorder behavior, then you're in good recovery. Because if you take the problem and then you stack your eating disorder on top of that and try to starve yourself or overeat or binging and purging, you're going to have a bigger problem than you started with. So I hope this helps to give you a little bit of hope about recovery. People don't ever think that you can't recover. Thousands of people recover every year from eating disorders. And there are millions of people out there now suffering from eating disorders. 20 million women, 10 million men. So men are showing up. I think they've always had eating disorders, but they just weren't given permission to go for help. So there's a lot of folks out there that are still suffering. If you're in recovery from an eating disorder, thank God and thank yourself and the people around you that are helping you, because you're doing something that is one of the hardest things in the world to do. And that is to stop this habit, that hand to mouth, always having to have something in your hand to put in your mouth. So I hope this is helpful. It's been a wonderful week touching on the different types of eating disorders. And if you have a problem with food, the not eating, the overeating, the eating and purging, and by the way, you don't have to wait till you're chronic. It's like I had a woman call me the other day, and she said that she was doing this eating disorder a little bit, and this a little bit, and this a little bit, and drinking a little bit, and doing this. And she said, but I don't know if I have a problem. And I said, well, eating disorders, I said, have you ever, because I knew she had children, and I said, have you ever been just a little bit pregnant? See, we're not a little bit pregnant. We're either pregnant or we're not. But it shows more in 9 months than it did in the first couple of months. That's the same way with eating disorder. Eating disorder has a starting place, and it doesn't show that much. But as it progresses, as the weight comes on for the binge eater, it comes off of the anorexic, and then the bulimic starts showing signs of symptoms, the big chipmunk jaws and the enamel coming off the teeth. The secret is out, So if you are suffering from any form of an eating disorder, or have a family member, or if you know anyone that does, give us a call. We know some wonderful people in the field that do interventions, and sometimes people need to have an intervention done on them. That is the most loving thing that any family member could do for a person with an eating disorder, is to do an intervention on them. So at Shades of Hope, we do free assessments. If you need us or want to ask any questions, please call the center. It's 325-572-3843. And the folks that answer the phone will refer you to the intake people. They'll answer any questions and invite you to come for a visit, or you might come for a 4-day intensive. Not everyone needs inpatient treatment. And that 4-day intensive is a wonderful way to treat that emotional side. When people get the physical part of the disease sort of, at bay, where you're dealing with it, then that 4-day intensive that we do helps treat the mental and emotional side. So we're here. If you ever need us, call us. Have a wonderful weekend. Enjoy. If your area has some sunshine, enjoy it. And hope to see you or talk with you later. Thank you.